Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each week, we deliver informative health and wellness topics you want to know about, so be sure to subscribe to us on your favorite podcast channel. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session, streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Operating Officer Kyle Longton.
Hi, and welcome to AFSPA Talks. I'm your host, Kyle Longton. It's August, and for many of us, that means we're preparing for back to school. And with that in mind, AFSPA Talks and our AFSPA Live later this month will be focused on children's health. So longtime listeners of this podcast might recall that I have 3 kids. Twins are entering first grade this year, and my youngest is starting preschool. All of them are entering new environments after some COVID-related delays, and that means that there's been a lot for us to prepare. We are dealing with a lot of changes and adjustments, and some of that includes some visits to the doctor, some seeking out resources for some of the feelings that all of us are having about changes, including anxiety and fear, and even excitement. As I'm getting things ready for my family, I am hoping that we at AFSPA can provide some help to you and your family. So to kick things off this month, we put together a few clips from 2 past episodes of this podcast. These were episodes focused on sort of preparing to welcome a child, as well as a broad overview of healthcare for children. So first up, we have some excerpts from my conversation with Dr. Joanne Armstrong, Chief Medical Officer for Women's Health and Genomics at CVS Health. She and I talked a bit about how to set the stage for successful pregnancy and birth that would lead to better outcomes and a healthier newborn. If you're interested, you can find our full conversation on November 15th, 2021 in the AFSPA Talks feed. And then after that, we are sharing some information from my interview with Dr. Elena Pearl Ben-Joseph, a pediatrician and medical editor at the Center for Health Delivery Innovation and kidshealth.org and the Nemours Children's Health System. Last August 23rd, we talked about back to school wellness, vaccines, preventive care, and some resources that might help you and your family. The full episode, which you can also find in our feed, included an extensive overview of our understanding of COVID's effects on children at that time. I encourage you to listen to it if you're interested. But for right now, let's go ahead and begin with some information from my conversation with Dr. Armstrong. I want to start out with sort of a broad question. Knowing that each person is different and each pregnancy is going to be different, can you share with us some common elements of a healthy pregnancy? What is the goal when we're looking at healthy pregnancy?
So great question. Healthy pregnancy actually begins before pregnancy. It really starts with the intention of every woman and family for what they want to do from a reproductive perspective. It's important to note that about half of the pregnancies in the U.S. are not planned, and by not planning, there's a lot that is lost. One of those things is just the timing of pregnancy, right? It's good to plan pregnancies when you're emotionally ready, financially ready, and importantly, physically and physiologically ready. So not planning misses that opportunity. The other thing that's important is pregnancies that come close together, that is not well spaced or not having optimal interconception spacing, can have some medical complications on their own. For example, babies can be smaller. Some women have increased rates of preterm birth. The other thing that's really important in planning pregnancy is women have, on average, about 10% of women have some chronic condition that they go into pregnancy with. And this period is the time to really optimize that. So, and some of these things actually can get worse because the physiology of pregnancy can make them worse. And so they need to be optimized beforehand. A few examples of that.
Yeah, that'd be great.
Yeah. So a few examples of that are women, for example, women with chronic hypertension. There's some medications that are dangerous to take during pregnancy because they can have effects on the development of the baby. So you would want to change those medications before you could become pregnant. For women who have chronic depression, for example, or some other behavioral health challenges, those medications also some of them may not be safe or better optimized in pregnancy. In the case of diabetes, where women have pre-gestational diabetes, very high levels of glucose. So in other words, diabetes that is not well managed has two important effects in pregnancy. One, it can increase the rate of miscarriage. And two, it can also influence the development of the fetus and result in birth defects. So preconceptionally is the time to really get diabetes under control. And then there are a number of conditions that are similar: weight management, smoking cessation, et cetera.
And so what steps, I mean, we've touched on it a little bit, but what role might a relationship with a primary care doctor or a regular relationship with an OBGYN play in optimizing oneself for in one situation for pregnancy?
So one of the things that I really advocated with my own patients is in every visit, just to ask this question. I think clinicians should ask it, and women should also be thinking about it. What are my reproductive intentions this year? Would I like to become pregnant? Whether you're going in for a sinus infection or a regular GYN exam, it's just a question that we should ask ourselves. And are we moving in the direction of health? If the answer, well, we should always move in the direction of health. But if we are particularly interested in planning pregnancy, we should have this in our head that many of the challenges that we face take a long time to sort of get control of, whether it's smoking cessation or completing vaccine series or having a past history of an abnormal pap smear evaluated. So I advocate that patients should think, what are my intentions this year, and am I really taking care of my intentions? And clinicians should do the same thing. And then, of course, depending on the answer to that, one either, right, thinks about what contraception or family planning might look like if you're not interested in becoming pregnant. And if one is interested in becoming pregnant, it's a question of when would I like to become pregnant? And what steps should I take between sort of now and when I would ideally like to become pregnant? So that's really the starting point. It's a good sort of mental exercise for us to do all the time anyway.
And once somebody thinks that they're pregnant, they have that first positive home test, what is the next step they should take? They've got the test in hand. Is it a call to the doctor? Is it a visit? What is the next step?
So the next step really is to pause, congratulate yourself, think about, just take these moments, right, of sort of joy and expectation, visualizing, what's next. I think that's really important because we often sort of get on this track where it's like you just start right away thinking about, I've got 100 things to do. And it's really important to pause, center yourself in your own pregnancy and ask, what is it that I want? Think about that. So some of the things, the choices that can come up are things like, well, what type of pregnancy care model am I interested in? Am I interested in midwifery-based care, for example? Am I not interested in that? Do I have a good relationship with my OBGYN? Is this somebody who hears me, who has enough time for me, not a judgment? Some practices are just really busy, or they're structured in a way that there are just a lot of physicians and you're not sure that you have a relationship with anybody in the practice. So pause, ask yourself, what is it? What are my intentions here? And do some work to sort of think about what model of care you want and what that provider would look like. And there are lots of ways to find information about that, right? Dr. Wikipedia is one. Right. But, close friends, and ask questions, like really pragmatic questions. How often do I see the same doctor? Does this practice, what are the hours? Are they flexible enough that they fit in my schedule? Was there time spent to sort of listen to me, to hear me and my voice and what I want? So there are a number of pragmatic things just to think through about what type of birth one wants. Was there something that happened in the last pregnancy that you really want to reflect on and say, really wasn't the model for me? I felt not listened to. I felt rushed. There was something about the hospital environment, the way I and my baby were treated together, for example. I'm not saying this to be judgmental in some way. I just want to elevate the issue that we have choices, often have choices. And by taking a few moments to sort of think, what is this experience that I want to have? Obviously, it must be safe, but is it really centered on me and my choices? Does it fit the type of life that I have? Is there any flexibility in that schedule? And do I have other past experiences that either I've had or perhaps my friends have had that might inform how I want to think about this? So that's the first step.
Absolutely. And I think I appreciate you saying take a moment, pause and savor that news, because sometimes we move right past that moment and miss it, and we're making an appointment for the first prenatal visit or choosing a doctor if we're in a new place, all those things. So I appreciate you inserting that in there, and then going on to the practical matters and seeking input from your friends and others, and reflecting on past experiences. So as we're thinking about the goal of a healthy pregnancy, a healthy delivery, and so forth, there are some complications that can arise during pregnancy. And you've talked about ways to sort of optimize health going into pregnancy and preparing for pregnancy. And you touched on some of the possible complications that can arise. But I'm wondering if you can go a bit more in depth on some of the most common complications that arise during pregnancies and how they are identified and addressed.
Yes, for sure. And I would say that, complications arise in pregnancy. And as I noted, complications could have arisen in a prior pregnancy that have implications for this pregnancy. Mm-hmm. Or women, of course, we come in with our own chronic conditions, et cetera. So if this is not the first pregnancy for patients, it's important, and they're not going to the same physician, it's important to get your medical records from the prior pregnancy so that can be shared with your current obstetrician. It really helps the physician really understand, perhaps if there was a preterm birth, what was actually behind that, a complication, an urgent cesarean delivery. There's nothing like having the exact records, maybe the lab values, to understand what this is, what happened. So as we enter into prenatal care, the first visit that women have, it's really busy, right? There's a review of your past history. So again, coming in with a coordinated, list of your medical problems, the medications that you might be on, the records that you had from a past pregnancy will really help organize that information and actually give you a little more time with the physician to open up the space to talk about these other things that are not necessarily medical. The first visit also goes over family and genetic risk. These are particularly important to have these conversations with a physician and determine whether there's certain genetic testing that's recommended for you or genetic counseling. So again, bringing that in. I'll also make a plug that November is the time that families, at least in the U.S., families gather around the Thanksgiving table. It's multi-generational. Families, it's our time to ask about genetic conditions that might run through families that actually may have implications in, for your own personal health and for your pregnancy. So then once we sort of have an understanding of women, pregnant people coming in, sort of their past history, past obstetrical history, then we sort of start walking through pregnancy and some of the problems that can happen in pregnancy. So some of the more common ones are what's called gestational diabetes, and that is diabetes that happens because of the physiology of pregnancy. Okay, it's different than having it pre-gestational, and sometimes it's hard to unwind whether someone who presents with diabetes actually had it before their pregnancy or during pregnancy. But upwards of as many as 10% of pregnant women will develop diabetes, what's called gestational diabetes. Another really important problem in pregnancy is called preeclampsia. And preeclampsia is this really weird form of hypertension that happens only in pregnant women, and it accelerates very quickly, and the treatment for it is delivery. It tends to happen in the later part of pregnancy. It occurs in about 4 to 8% of women. It is a major cause of preterm birth, low birth weight, and severe complications for mom and for the baby as well. We know what the risk factors are for that, although half of the women don't have risk factors. What's really important about preeclampsia that I really want to make a strong plug for is there is a very simple intervention in the form of low-dose aspirin that can lower the rate of this, really bad disease by as much as 30%.
Wow.
And and what's really important about it is, and low-dose aspirin is recommended for women who have what are called major risk factors, which include a past history of preeclampsia. So bring your records in, chronic hypertension, diabetes, connective tissue disorders, but lupus and things like that. But it's also, a risk factor is also defined as women who have what are called 2 moderate risk factors. And those are much more common. Advanced maternal age, that proud group that I was a member of as well. So women greater than 35 when they have their child, women having a first baby, women who are obese, women who have particular stress, environmental stress, or even stress that's related to race. Women, African-American women, poor women, it's all under the bucket of stress. But women with 2 of those moderate risk factors are also at risk. And very often we don't appreciate, that we're in those groups, and there's literature that backs that up. So important here is to sort of understand this disease, talk to your physician about it. Low-dose aspirin starts early in pregnancy, as early as 12 weeks. And it continues all the way through. So a really important, simple, and very safe intervention to lower the rate of an important disease significantly. But it requires, a discussion and awareness of this and a conversation with your physician. The other thing that I would like, so we've talked about diabetes, we've talked about chronic hypertension and this preeclampsia, this weird form. I want to, because we are living in the age of COVID, I'd like to just take a moment, if it's okay, to talk about COVID and pregnancy.
Please.
Okay. So pregnancy, the being pregnant itself is a high-risk group for severe complications of COVID. The reason for that is because the physiology of pregnancy, having basically a big uterus like a watermelon in your abdomen makes it hard for us to breathe. Right? Our lung excursion is decreased. And pregnancy is also a kind of a relatively immunocompromised state. When you think about it, this beautiful thing that is the physiology of birth, we have to kind of suppress a little bit of our immune system to grow a baby that's not actually antigenically, immunologically like us. And so that makes pregnant women more susceptible to severe respiratory infections, particularly, so COVID and flu. So COVID and flu both are recommended for vaccine during pregnancy. Only about 30% of women are vaccinated in pregnancy. Half of those come in as vaccinated preconceptionally. So again, the importance of preconception care and the importance of COVID is that half of our pregnancies are not planned. It is a risk factor for bad things to happen, and those bad things that can happen to pregnant women are they have much higher rates of hospitalization, the requirement for ICU admissions, requirement for intubation and respiratory support, and maternal death. And their babies also have a higher rate of adverse problems in pregnancy related to preterm birth, low birth weight infants, et cetera. So really important to get COVID vaccinated. It is recommended by every professional college that is devoted to the safety and the health of pregnant moms and their babies. Pediatricians, recommend this as well, and it is safe. There's now a lot of emerging data that it is safe in pregnancy.
And I so appreciate that, because there were questions. I think I've heard people in my own life say, "Oh, I don't know if it's safe to while I'm trying to conceive or while I'm pregnant." And I so appreciate having you here as an expert and confirming the data that's out there and sharing it that it is safe. And I think there are also other vaccines that you would recommend, from a previous conversation we've had, for those who are pregnant, and I think also those who would be around a newborn. What are there's two particular vaccines that we talked about before, the flu and the Tdap. Is that right?
That's right. So flu, or seasonal flu virus, is a problem in pregnant women for the same reasons I just talked about, the physiology of pregnancy. So pregnant women are a high risk group for requiring hospitalization due to flu. So all pregnant women are recommended to get the flu vaccine during flu season. So, beginning in October. It is safe. It's been, that vaccine recommendation has been in place for many, many years in the U.S. Millions of women are vaccinated every year for flu, and very safely. On average, though, only about 50% of women get vaccinated for flu. And some of the reasons for that are OBGYNs generally are not vaccinators in the way, family docs are, for example. So, if you're, here for people who are listening to this, excuse me, ask about flu vaccine. If your physician does not vaccinate, there are lots of places to go. CVS Health, the pharmacy counters are there, the minute clinics. There are flu clinics, vaccine clinics, all over the place. It's really important and very safe. The second vaccine recommendation is called Tdap, and it's for the P in Tdap is for pertussis, which is whooping cough. And whooping cough is another important infection that in pregnant women, but particularly their infants, it's one of the leading causes of viral hospitalizations for newborns. And we vaccinate moms because by vaccinating mom, you provide passive protection to babies. And this is true for flu, for pertussis, and the data is emerging that it is also true for COVID. So how does this work? A baby's immune system is not fully formed at birth. It is, it develops over the next months. And so babies are susceptible to respiratory infections when they are born. So vaccinating mom, actually those antibodies that the mom antibodies are what protect us against invading viruses. They get passed through the placenta to the mom, to the baby rather, and then it protects the baby during this critical period of time where they are too young to be vaccinated, but it gives them a bubble of protection around them. So for these three vaccines, very important in pregnant women.
Fantastic. And I'll just note for our listeners, all of those vaccines covered at 100% by Foreign Service Benefit Plan, as well as other federal plans. And as Dr. Armstrong noted, available at pharmacy counters, at minute clinics, and with your primary care physician likely. So please seek those out. Now, I want to turn to my earlier conversation with Dr. Pearl Ben-Joseph, where she shares some basics on preventive care, screenings, and vaccines for kids. And I think about back to school, I think about wellness visits, maybe some vaccinations, maybe vaccination records that we've got to turn into the schools, sports physicals, and so forth. Now, I know from our health plan side and anecdotally that healthcare utilization was down in 2020 and even into 2021. So a lot of people put off preventive care, including children. What in your experience, in your understanding of what your colleagues are doing in their clinical practices and so forth, have you seen evidence of delayed care in pediatrics?
Yes, absolutely. I think not just in pediatrics, yeah. It's been across the board, but it's very true. The pandemic has definitely led to delays in preventive care visits and in vaccinations. Partly because families were told to stay home, especially at the beginning of the pandemic. We were shut down or locked down as a measure to stop the spread. But even when families were asked, please come in, bring your child to get them vaccinated, to have their well child visits, bring your sick children in if they're not feeling well. Families were scared for fear of catching the virus. So I've seen surveys that showed that a quarter of all families either missed, skipped, or delayed these well child visits. And some studies even showed bigger numbers, as much as maybe half of all visits being down due to the pandemic.
Well, and you mentioned both, the well child visits, even sick visits were delayed, but you also mentioned vaccines were delayed and missed. What effects could these delays in preventive care, as well as with vaccines, have on either short-term or long-term development?
Right, vaccinations really dropped significantly in all kids right after the pandemic started. And it looks like the younger kids are now getting vaccinated again, but the older ones still have a decrease in vaccination rates, unfortunately. And this puts them at risk for vaccine preventable diseases. Let's talk about vaccines that kids routinely get. I think is really important. Babies get a whole bunch of vaccines for diseases that we really hardly ever see anymore because the vaccines have prevented them. So things like tetanus, diphtheria, whooping cough, polio, measles, mumps, rubella, just a whole slew of illnesses that have been prevented due to vaccines. And there's also some infections that we do see, hepatitis, which are viral infections, or chickenpox, definitely flu. But vaccines really have brought those numbers down of those infections. Some vaccines fight bacteria that used to cause awful diseases, severe pneumonias, meningitis. Those vaccines are called, or those bacteria are called pneumococcus or Haemophilus, that I remember learning about in medical school way back. We don't see them anymore. We just, so it's incredible. The 14 potentially very serious diseases in kids are prevented by vaccines. So, and vaccines are actually given according to a specific schedule based on how the children's immune system will respond to them at various ages and how likely kids are to be exposed to that particular disease. So delaying the vaccines, as I said, can leave kids vulnerable and unprotected, specifically when they're most likely to have serious complications from these diseases. And I'll give you an example. Whooping cough can be just an annoying cough in a teenager or in an adult. They call it the 100-day cough. It's a nuisance. But for a baby, it can really be deadly. So that's why we give whooping cough vaccines when they're babies early on. We don't wait until they're older. The key is to give the vaccines before the child has a chance of getting exposed to the disease. We don't wait until a car crashes to then put on our seatbelts, right? We put the seatbelt right at the beginning of the ride. So it's the same with vaccines. We want babies to get them long before they're actually exposed.
Right. And I want to return, we'll probably return to the topic of vaccines a little bit later when we dig in on COVID. But just to touch on preventive care again, there are a lot of screenings that happen in those well child visits. Are there effects on short-term and long-term development that we're seeing or may see because those visits have been missed?
Well, short-term, maybe we can talk about. Long-term is a little bit harder because we need to study that over the long term. But definitely well child checkups for preventive care are times that pediatricians will screen for developmental problems. For example, we might catch delays in speech or in walking or problems with feeding or problems with growing. We might uncover depression or anxiety or other mental health problems. And we've certainly seen those more than ever during the pandemic. And children short term might end up in the emergency department with, let's say, for example, depression or anxiety, statuses that are much more severe than had they been caught at an earlier stage. But besides development, pediatricians will also screen for medical conditions that might otherwise go under the radar because they don't always cause symptoms. So for example, we'll measure blood pressure, listen for heart murmurs, feel the belly to make sure there's no masses or anything that's enlarged. We'll check vision, we'll check hearing. We also send children for tests to look for things like anemia or lead levels in the blood. So all of these things are things that parents don't see and will miss if they don't actually go for their well child visits. And I'll give you an example. I heard a lot of stories about leukemias that were not caught in time. Children showed up to emergency departments when they were already very symptomatic. And they were just simply missed because the parents were scared to come in, or maybe they had an early form of telehealth that was just by phone, and didn't have really proper physical examination. And parents might not notice how pale a child looks, or the paleness of the red around inside the eye. That's part of what pediatricians are trained to catch. So definitely short-term illnesses may have been missed. Longer term, we're going to have to wait and see what happens with kids' development.
And I appreciate that you touched on some of the behavioral and mental health pieces that we're seeing, and we've addressed that in some of our previous episodes of this podcast. So you mentioned that there are screenings that take place at various ages for behavioral health issues, and that those well child visits play a role in diagnosing that. And I'm particularly thinking of the effect of the last year, as you mentioned, that depression and anxiety have emerged. Can you expand a little bit on what you're seeing in your research and what clinicians are seeing in their treatment?
Absolutely. Well, as I said before, we've seen an uptick in mental health problems in kids over the course of the pandemic. And well child visits and timely sick kid visits are really essential in discovering these things early on, so that we can get a head start on assessing and on treating. So let me reemphasize how important the well child visits are. As I mentioned earlier, pediatricians will assess development informally at every visit. They'll ask about a parent's concerns, they'll observe the child, they'll ask about the home environment, but they also do more formal and in-depth developmental and behavioral screening for all kids during the well child visits at ages 9, 18, and 30 months. And on top of that, they'll screen specifically for autism spectrum disorder before a child turns 2. So that's for the littles. But we continue to screen older kids for development, for behaviors. In teens, we start to screen for depression. We'll assess for things like ADHD, if the child is hyperactive or inattentive. If they're struggling in school, we might assess for learning disorders.
So I want to take a minute, because I'm a parent of young children myself, and sometimes I'm not sure where to turn to. And Google will give me all kinds of answers, but I don't always know about the usefulness or the origin of those answers. So I want to talk about a resource that you've helped to build, and that's Kids Health. That's actually how we connected, was through your work on Kids Health, and that AFSPA and our Foreign Service Benefit Plan have long promoted this resource for our members. Can you briefly, because there's a lot on there, but can you briefly share with our listeners what kind of information they can find on Kids Health, and maybe even a little bit about how that information is put together?
Sure. So Kids Health is a free website, can be seen and accessed by everyone. It's put together by a fabulous multidisciplinary group that includes medical professionals who edit the material, experienced health writers, editors, illustrators, IT technicians, a marketing team. We have just all kinds of people who work together to create information about children's health, available by topic, by age. We actually have 3 audiences. We speak to parents, we speak to teens, and we speak to kids. And actually, we have a 4th audience. We also create educational materials for educators, for teachers. And the topics run the gamut, from anything to do with children and their health. So it could be illnesses or injuries. It could be just development, behaviors, emotions, first aid, fitness, food, you name it. There's even recipes and games for kids. So, I think your listeners should just check it out. Visit kidshealth.org and explore it.
Yep. And I think this is really an underutilized resource, at least in my circle of parents of kids, my kids' age. But I have started using it. I'm excited. My kids are very interested in helping me cook. So we'll be trying some of the recipes and trying to get them engaged. So I appreciate the work that you and your colleagues are doing, because it's a fantastic resource. Thank you. Thanks for joining us for this episode of AFSPA Talks, and my thanks to Dr. Armstrong and Dr. Pearl Ben-Joseph for sharing their expertise with us. You can find more information at kidshealth.org and on our website, afspa.org. Also, subscribe to this podcast and prepare to tune in for the AFSPA Live the last Thursday of this month at 11 a.m. Eastern. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational, and the views expressed by the host and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or the other products offered by AFSPA, the policy provisions will prevail. Thanks for listening, and again, be sure to subscribe to AFSPA Talks to catch our next episode, and watch our social feeds on Facebook, Instagram, or LinkedIn. Look for at AFSPA Cares, as well as on YouTube, youtube.com/AFSPA Cares, to see upcoming events, including AFSPA Live. See you next time.
Thanks for joining us this week on AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live on our YouTube channel at youtube.com/AFSPA Cares at 11 a.m. Eastern Time to answer your questions. Thanks for listening.